A pregnant client at 28-week gestation asks which vaccines are safe during pregnancy. Which vaccine should the nurse recommend? MMR, Varicella, Tdap, and HPV. Can live vaccinations be given during pregnancy? When should Tdap be given in the pregnancy for maximum newborn protection? Is the flu vaccine safe in all trimesters? If these questions confuse you, don't worry. Welcome to my YouTube channel, ManpreetRN Talks. So today we are going to discuss about the vaccinations, which vaccinations are safe during pregnancy and which vaccination those are not safe during pregnancy. So pregnant mothers, they have a suppressed immune system and they are at an increased risk for illness. In general, no live vaccination are given during and up to 1 to 3 months before pregnancy, as live vaccination cause serious birth defects to a developing uterus in the utero. So live vaccination do not give during pregnancy. So write down the name of the vaccination that is safe during the pregnancy. It is inactivated influenza, flu shot, Tdap vaccination. So that is given between 27 to 36 week. T is tetanus, T diphtheria, P pertussis. So these are the safe vaccination and other one that are not safe during the pregnancy. So live vaccine they are not safe. So write down that is varicella zoster, chickenpox, rotavirus, live and activated form of influenza, flu shot, and MMR, measles, mumps, rubella. So varicella vaccine that is given postpartum. So always teach the client to have a second dose vaccination in coming 4 to 8 weeks and use contraception for 1 month to avoid pregnancy. That is very important for NCLEX point of view. So practice questions. A nurse is reviewing immunization history of a pregnant client. Which vaccine can be given if the client is at high risk? HPV, MMR, hepatitis B, and varicella. So write down the correct answer in the comment box. So next question is, which statement by a pregnant client indicates correct understanding of vaccines? A. I can receive MMR during pregnancy. Tdap protects my baby after birth. Live vaccines, they are safe in the pregnancy. Vaccination should be avoided until delivery. So write down the correct answer in the comment box. A pregnant woman in her first trimester asked about the activated flu vaccine. So what is the best response by the nurse? A. Wait until after delivery. B. It is safe in all trimesters. C. Only live flu vaccine is recommended. D. Flu vaccine is unsafe in the pregnancy. So write down the correct answer in the comment box. So future nurses, NCLEX is not about memorizing everything. So it's about understanding the key concepts. So be a smart nurses, study today, pass NCLEX tomorrow. Join my with RN Talks for more updates.